7.3 AIDS. The word AIDS stands for Acquired Immunodeficiency Syndrome. This means deficiency of immune system acquired during the lifetime of an individual, indicating that it is not a congenital disease. Syndrome means a group of symptoms. AIDS was first reported in 1981, and in the last 25 years or so, it has spread all over the world, killing more than 25 million persons. AIDS is caused by the human immunodeficiency virus HIV, a member of a group of viruses called a retrovirus, which have an envelope enclosing the RNA genome, figure 7.6. Transmission of HIV infection generally occurs by A. Sexual contact with infected person, B. By transfusion of contaminated blood and blood products, C. By sharing infected needles as in the case of intravenous drug abusers, and number D. From infected mother to her child through placenta. So people who are at high risk of getting this infection includes individuals who have multiple sexual partners, drug addicts who take drugs intravenously, individuals who require repeated blood transfusions, and children born to an HIV infected mother. Do you know when do people need repeated blood transfusion? Find out and make a list of such conditions. It is important to note that HIV or AIDS is not spread by mere touch or physical contact. It spreads only through body fluids. It is hence imperative for the physical and mental well-being that the HIV or AIDS infected persons are not isolated from family and society. There is always a time lag between the infection and appearance of AIDS symptoms. This period may vary from a few months to many years, usually 5 to 10 years. After getting into the body of the person, the virus enters into macrophages where RNA genome of the virus replicates to form viral DNA with the help of the enzyme reverse transcriptase. This viral DNA gets incorporated into host cells' DNA and directs the infected cells to produce virus particles, figure 7.6. The macrophage continue to produce virus and in this way acts like a HIV factory. Simultaneously, HIV enters into helper T lymphocytes TH, replicates and produce progeny viruses. The progeny viruses are released in the blood attack other helper T lymphocytes. This is repeated, leading to a progressive decrease in the number of helper T lymphocytes in the body of the infected person. During this period, the person suffers from bouts of fever, diarrhea, and weight loss. Due to decrease in the number of helper T lymphocytes, the person starts suffering from infections that could have been otherwise overcome, such as those due to bacteria, especially mycobacterium, viruses, fungi, and even parasites like toxoplasma. The patient becomes so immunodeficient that he or she is unable to protect himself or herself against these infections. A widely used diagnostic test for AIDS is enzyme linked immunosorbent assay ELISA, ELISA. Treatment of AIDS with antiretroviral drugs is only partially effective. They can only prolong the life of the patient but cannot prevent death, which is inevitable. Prevention of AIDS. As AIDS has no cure, prevention is the best option. Moreover, HIV infection more often spreads due to conscious behavior patterns and is not something that happens inadvertently, like pneumonia or typhoid. Of course, infection in blood transfusion patients, newborns from mother, etc., may take place due to poor monitoring. The only excuse may be ignorance, and it has been rightly said that don't die of ignorance. In our country, the National AIDS Control Organization NACO, and other non-governmental organization NGOs are doing a lot to educate people about AIDS. WHO has started a number of programs to prevent the spreading of HIV infection, making blood that is from blood banks safe from HIV, ensuring the use of only disposable needles and syringes in public and private hospitals and clinics, free distribution of condoms, controlling drug abuse, advocating safe sex and promoting regular checkups for HIV in susceptible populations are some such steps taken up. Infection with HIV or having AIDS is something that should not be hidden, since then the infection may spread to many more people. HIV or AIDS infected people need help and sympathy instead of being shunned by society. Unless society recognizes it as a problem to be dealt with in a collective manner, the chances of wider spread of the disease increase manyfold. It is a malady that can only be tackled by the society and medical fraternity acting together to prevent the spread of the disease. 7.4 Cancer. Cancer is one of the most dreaded diseases of human beings and is a major cause of death all over the globe. More than a million Indians suffer from cancer and a large number of them die from it annually. The mechanisms that underlie development of cancer or oncogenic transformation of cells, its treatment and control have been some of the most intense areas of research in biology and medicine. In our body, cell growth and differentiation is highly controlled and regulated. In cancer cells, there is a breakdown of these regulatory mechanisms. Normal cells show property called contact inhibition, by virtue of which contact with other cells inhibits their uncontrolled growth. Normal cells show a property called contact inhibition, by virtue of which contact with other cells inhibit their uncontrolled growth. Cancer cells appears to have lost this property. As a result of this, cancerous cells just continue to divide, giving rise to masses of cells called tumors. Tumors are of two types, benign and malignant. Benign tumors normally remain confined to their original location and do not spread to other parts of the body and cause little damage. The malignant tumors, on the other hand, are a mass of proliferating cells called neoplastic or tumor cells. These cells grow very rapidly, invading and damaging the surrounding normal tissues. As these cells actively divide and grow, they also starve the normal cells by competing for vital nutrients. Cells slaughtered from such tumors reach distant sites through blood, and wherever they get logged in the body, they start a new tumor there. This property, called metastasis, is the most feared property of malignant tumors. Causes of cancer. Transformation of normal cells into cancerous neoplastic cells may be induced by physical, chemical, or biological agents. These agents are called carcinogens. Ionizing radiations like X rays and gamma rays and non ionizing radiations like UV cause a DNA damage, leading to neoplastic transformation. The chemical carcinogens present in tobacco smoke have been identified as a major cause of lung cancer. Cancer causing viruses called oncogenic viruses have genes called viral oncogenes. Furthermore, several genes called cellular oncogenes, C-onc or proto-oncogenes, have been identified in normal cells, which, when activated under certain conditions, could lead to oncogenic transformation of the cells. Cancer detection and diagnosis. Early detection of cancer is essential as it allows the disease to be treated successfully in many cases. Cancer detection is based on biopsy and histopathological studies of the tissue and blood, and bone marrow test for increased cell counts in the case of leukemias. In biopsy, a piece of the suspected tissue cut into thin sections is stained and examined under microscope histopathological studies by a pathologist. Techniques like radiography, use of X-rays, CT, computed tomography, and MRI, magnetic resonance imaging, are very useful to detect cancer of the internal organs. Computed tomography uses X-rays to generate a three-dimensional image of the internals of an object. MRI uses strong magnetic fields and non-ionizing radiations to accurately detect pathological and physiological changes in the living tissue. Antibodies against cancer specific antigens are also used for detection of certain cancers. Techniques of molecular biology can be applied to detect genes in individuals with inherited susceptibility to certain cancers. Identification of such genes which predispose an individual to certain cancers may be very helpful in prevention of cancers. Such individuals may be advised to avoid exposure to particular carcinogens to which they are susceptible. Example, tobacco smoke in case of lung cancer. Treatment of cancer. The common approaches for treatment of cancer are surgery, radiation therapy, and immunotherapy. In radiotherapy, tumor cells are irradiated lethally, taking proper care of the normal tissues surrounding the tumor mass. Several chemotherapeutic drugs are used to kill cancerous cells. Some of these are specific for particular tumors. Majority of drugs have side effects like hair loss, anemia, etc. Most cancers are treated by combination of surgery, radiotherapy and chemotherapy. Tumor cells have been shown to avoid detection and destruction by immune system. Therefore, the patients are given substances called biological response modifiers such as alpha interferon which activates their immune system and helps in destroying the tumor. 7.5 Drugs and alcohol abuse. Surveys and statistics show that use of drugs and alcohols have been on the rise, especially among the youth. This is really a cause of concern as it could result in many harmful effects. Proper education and guidance would enable youth to safeguard themselves against these dangerous behavior patterns and follow healthy lifestyles. The drugs which are commonly abused are opioids, cannabinoids, and coca alkaloids. Majority of these are obtained from flowering plants. Some are obtained from fungi. Opioids are the drugs which bind to specific opioid receptors present in our central nervous system CNS and gastrointestinal tract GI tract. Heroin, figure 7.7, commonly called smack, is chemically diacetyl morphine, which is a white, odorless, bitter crystalline compound. This is obtained by acetylation of morphine, figure 7.7, which is extracted from the latex of poppy plant Papaver somniferum. Figure 7.8. Generally taken by snorting and injection, heroin is a depressant and slows down body functions. Cannabinoids are a group of chemicals, figure 7.9, which interact with cannabinoid receptors present principally in the brain. Natural cannabinoids are obtained from the inflorescences of the plant Cannabis sativa, figure 7.10. The flower tops, leaves, and the resin of cannabis plant are used in various combinations to produce marijuana, hashish, charas, and ganja. Generally taken by inhalation and oral ingestion, these are known for their effects on cardiovascular system of the body. Coca alkaloid or cocaine is obtained from coca plant Erythroxylum coca native to South America. It interferes with the transport of the neurotransmitter dopamine. Cocaine, commonly called coke or crack, is usually snorted. It has a potent stimulating action on central nervous system, producing a sense of euphoria and increased energy. Excessive doses of cocaine causes hallucinations. Other well-known plants with hallucinogenic properties are Atropa belladonna and Datura. Figure 7.11. These days, cannabinoids are also being abused by some sports person. Drugs like barbiturates, amphetamines, benzodiazepines, and other similar drugs that are normally used as medicines to help patients cope with mental illness like depression and insomnia are often abused. Morphine is a very effective sedative and painkiller and is very useful in patients who have undergone surgery. Several plants, fruits, and seeds having hallucinogenic properties have been used for hundreds of years in folk medicine, religious ceremonies, and rituals all over the globe. When these are taken for a purpose other than medicinal use or in amounts or frequency that impairs one's physical, physiological, or psychological functions, it constitutes drug abuse. Smoking also paves the way to harder drugs. Tobacco has been used by human beings for more than 400 years. It is smoked, chewed, or used as a snuff. Tobacco contains a large number of chemical substances, including nicotine and alkaloid. Nicotine stimulates adrenal gland to release adrenaline and noradrenaline into blood circulation, both of which raise blood pressure and increase heart rate. Smoking is associated with increased incidence of cancers of lung, urinary bladder, and throat. bronchitis, emphysema, coronary heart disease, gastric ulcer, etc. Tobacco chewing is associated with increased risk of cancer of the oral cavity. Smoking increases carbon monoxide (CO) content in blood and reduces the concentration of heme-bound oxygen. This causes oxygen deficiency in the body. When one buys packets of cigarettes, one cannot miss the statutory warning that is present on the packaging, which warns against smoking and says how it is injurious to health. Yet, smoking is very prevalent in society, both among young and old. Knowing the dangers of smoking and chewing tobacco and its addictive nature, the youth and old need to avoid these habits. Any addict requires counseling and medical help to get rid of the habit. 7.5.1 Adolescence and drug or alcohol abuse. Adolescence means both a period and a process during which a child becomes mature in terms of his or her attitudes and beliefs for effective participation in society. The period between 12 to 18 years of age may be thought of as adolescence period. In other words, adolescence is a bridge linking childhood and adulthood. Adolescence is accompanied by several biological and behavioral changes. Adolescence, thus, is a very vulnerable phase of mental and psychological development of an individual. Curiosity, need for adventure, and excitement and experimentation constitute common causes which motivate youngsters towards drug and alcohol use. A child's natural curiosity motivates him or her to experiment. This is complicated further by effects that might be perceived as benefits of alcohol or drug use. Thus, the first use of drugs or alcohol may be out of curiosity or experimentation, but later the child starts using this to escape facing problems. Of late, stress from pressures to excel in academics or examinations has played a significant role in persuading the youngsters to try alcohol and drugs. The perceptions among youth that it is cool or progressive to smoke, use drugs, or alcohol is also, in a way, a major cause of youth to start these habits. Televisions, movies, newspapers, internets also help to promote this perception. Other factors that have been seen to be associated with drug and alcohol abuse among adolescents are unstable or unsupportive family structures and peer pressure. Because of the perceived benefits, drugs are frequently used repeatedly. The most important thing which one fails to realize is the inherent addictive nature of alcohol and drugs. Addiction is a psychological attachment to certain effects such as euphoria and a temporary feeling of well being associated with drugs and alcohol. These drive people to take them even when these are not needed or even when their use becomes self destructive. With repeated use of drugs, the tolerance level of the receptors present in our body increases. Consequently, the receptors respond to only the higher doses of drugs or alcohol, leading to greater intake and addiction. However, it should be clearly borne in mind that use of these drugs, even once, can be a forerunner to addiction. Thus, the addictive potential of drugs and alcohol pull the user into a vicious circle leading to their regular use, that is, abuse, from which he/she may not be able to get out. In the absence of any guidance or counseling, the person gets addicted and becomes dependent on their use. Dependence is the tendency of the body to manifest a characteristic and unpleasant withdrawal syndrome if a regular dose of drugs or alcohol is abruptly discontinued. This is characterized by anxiety, sickness, nausea, and sweating, which may be relieved when use is resumed again. In some cases, withdrawal symptoms can be severe and even life threatening, and the person may need medical supervision. Dependence leads the patient to ignore all social norms in order to get sufficient funds to satiate his or her needs. These result in many social adjustment problems. 7.5.3 Effects of drug or alcohol abuse. The immediate adverse effects of drugs and alcohol abuse are manifested in the form of reckless behavior, vandalism, and violence. Excessive doses of drugs may lead to coma and death due to respiratory failure, heart failure, or cerebral hemorrhage. A combination of drugs or their intake along with alcohol generally results in overdosing and even death. The most common warning signs of drug and alcohol abuse among youth include drop in academic performance, unexplained absence from school or college, lack of interest in personal hygiene, withdrawal, isolation, depression, fatigue, aggressive and rebellious behavior, deteriorating relationship with family and friends, loss of interest in hobbies, change in sleeping and eating habits, fluctuations in weight, appetite, etc. There may even be some more far reaching implications of drug or alcohol abuse. If an abuser is unable to get money to buy drugs or alcohol, he/she may turn to stealing. The adverse effects are just not restricted to the person who is using drugs or alcohol. At times, a drug or alcohol addict becomes the cause of mental and financial distress to his or her entire family and friends. Those who take drugs intravenously, that is, direct injection into the vein using a needle and syringe, are much more likely to acquire serious infections like AIDS and hepatitis B. The viruses which are responsible for these diseases are transferred from one person to another by sharing of infected needles and syringes. Both AIDS and hepatitis B infections are chronic infections and ultimately fatal. Both can be transmitted through sexual contact or infected blood. The use of alcohol during adolescence may also have long term effects. It could lead to heavy drinking in adulthood. The chronic use of drugs and alcohol damages nervous system and liver cirrhosis. The use of drugs and alcohol during pregnancy is also known to adversely affect the fetus. Another misuse of drugs is what certain sports persons do to enhance their performance. They misuse narcotic analgesics, anabolic steroids, and diuretics, and certain hormones in sports to increase muscle strength and bulk and to promote aggressiveness and as a result increase athletic performance. The side effects of the use of anabolic steroids in female include masculization, that is features like males, increased aggressiveness, mood swings, depression, abnormal menstrual cycles, excessive hair growth on the face and body, enlargement of clitoris, deepening of voice. In males, it includes acne, increased aggressiveness, mood swings, depressions, reduction of size of the testicles, decreased sperm production, potential for kidney and liver dysfunction, breast enlargement, premature baldness, enlargement of the prostate gland. These effects may be permanent with prolonged use. In the adolescent, male or female, severe facial and body acne and premature closure of the growth centers of the long bones may result in stunted growth. 7.5.4 Prevention and Control.